Welcome back. This is Maggie Mann with Southeastern Idaho Public Health, and I have with me today Taia, one of our wonderful public health nurses, and she's here to share some information about adult immunizations. And that's a really important topic. A lot of people, when they think of immunizations, they think about kiddos, babies, because we know that kids need to be vaccinated for lots of different preventable diseases. But sometimes we forget that they're important for adults too. So that's what we're going to be talking with Taia about today. So Taia, welcome.
Thank you.
So what kinds of things should adults be vaccinated for?
Yeah, so it is routinely recommended that adults be vaccinated with a Tdap, which is tetanus, diphtheria, or pertussis, or whooping cough, at least every 10 years.
Okay.
COVID vaccines are, continuing to be recommended. An annual flu shot is recommended. And kind of a recent recommendation is for adults to be vaccinated against hepatitis B. And so that's either a 2 or a 3 dose series, depending on the brand. And then that is good for a lifetime.
Okay.
Yeah.
So haven't we gotten rid of a lot of the diseases that you mentioned in the United States? I mean, we don't see a lot of them anymore, do we?
Well, because of our vaccination efforts, it's true that there is a decreased prevalence of some diseases in the U.S., but some of those diseases are still common elsewhere in the world. So it's possible that an unvaccinated traveler could bring that back to our community. And so even if you or your family are not traveling internationally, it's still important that you are protected against those diseases.
Okay. And there are some of those diseases, things like pertussis or whooping cough. We still see that some in Idaho, correct?
We do. We have kind of small pockets of outbreaks every so often. It's true, yes.
And that is the reason that it's recommended for adults to be vaccinated is largely if they're around infants who haven't had the opportunity to be vaccinated. Is that correct?
That's correct. So infants can't be fully protected when they're very small. So it's especially important for parents, grandparents, other community members who are in contact with babies to be vaccinated against pertussis. Pertussis for you and I might just feel like cold symptoms, but it can be fatal to babies.
Yeah, and if you've ever listened to an infant trying to breathe who has pertussis, it's just heartbreaking. They just can't get the air in, and so, definitely important to be up to date on that if we're going to be around little ones.
For sure.
So what are the benefits of adult vaccination, Taia?
Yeah, so if you are vaccinated against a vaccine-preventable disease and you come into contact with that disease, it's likely you won't be infected. If you are infected, it will be a much more mild form of the disease. And so it really does protect against suffering and even death. It's also important for adults to be vaccinated so that they can provide protection to their families and communities as well. If you can't get that disease, you're not passing it along to other people in your community, people who might be vulnerable to severe complications from a disease like babies, like the elderly, like cancer patients, or people who can't be vaccinated for other medical reasons.
Okay. When you use that word suffering, it sort of triggered in my mind another one. What about shingles? Is there a vaccine for adults for shingles?
Yes. So shingles vaccine is routinely recommended now for all adults 50 and over.
Okay.
It's a 2-dose series. It's called Shingles.
Okay.
So those 2 doses happen 2 to 6 months apart. It's highly effective. And so, like I said, everybody 50 and over is a candidate for that. If you have a weakened immune system and you're 19 or over, then it may also be recommended, and you should talk to your doctor about that.
Okay, that's really good to know. Both my grandpa and my dad developed shingles in years before that vaccine was really available, and it was so painful and debilitating. So knowing that it's an effective vaccine and it's preventable, just definitely would encourage people to take advantage of that. So are vaccines safe, Taia?
So vaccines are generally considered very safe. Our country has a long history of safety programs in place. Vaccines have to be rigorously tested before they're offered to the public. Because our country's standard of safety is so high, oftentimes these vaccines are made available to the public in other countries for months or even years before we accept them here.
Okay.
So very safe. And then once they are made available to the public here, there's safety systems in place to continue to monitor those, not just the safety, but also the effectiveness of vaccines.
Okay, that's good to know. Do I need different vaccinations at different ages?
Yes, yeah. Like we talked about, shingles is recommended for everybody 50 and up.
Okay.
At age 65, pneumonia vaccine is recommended. Young adults might consider vaccines for meningococcal or HPV disease if they haven't already received those.
Okay.
So yes, depending on your age, you might need different vaccines, and also depending on your health conditions or your travel plans as well.
Okay. So both those things that you mentioned for young adults, meningococcal to help prevent meningitis,
Yes.
and HPV to help prevent human papillomavirus, which is the leading cause of cervical cancer and also a big contributor to oral cancers.
Yes.
So these vaccines are really effective in preventing really serious conditions, not just kind of nuisance conditions, but
Yes.
things that can be potentially fatal.
For sure. Yes.
Okay. So something that you hear a lot is, like, I've had people tell me, well, I got the flu shot and it made me sick. It gave me the flu. Can you talk a little bit about that myth?
Sure. So vaccines cannot give you a disease, but they can definitely make you feel a little under the weather. We are asking your body to develop an immune response to these vaccines, and that is what provides protection against the diseases later on. So common immune responses are a sore arm at the injection site, headache, and fatigue. But some people might also get an upset stomach, they might have a fever, they might have body aches. Any of these things will only last, a few hours to a few days, and can be relieved with over-the-counter medications and rest.
Okay, and all those things that you're talking about, they really kind of pale in comparison when you think about, like, with shingles.
Sure.
Or HPV, which can cause cancer.
Sure.
Or any of those things. So
Yeah, definitely worth it.
So, Taia, are there resources out there that people can search out for themselves if they'd like more information about vaccines that you think are reliable?
Definitely. The CDC has great information on their website. There's a website that is immunize.org that has really good information. And then I think we have information on our webpage as well.
Absolutely.
Yep.
Okay. Well, thank you so much, Taia. We appreciate you sharing that information about the important issue of adult vaccinations to help protect against preventable serious illness. So thanks for joining us, and for everyone else out there, thanks so much for tuning in, and be well, and we'll see you next time. Take care.